Making decisions at the point of care without adequate patient information, supported by evidence-based best practice, can be a challenge. To help overcome this, healthcare providers are increasingly using electronic tools to make the best possible care decisions. Medication reconciliation is one such example. At the University Health Network, this all starts with the creation of the best possible medication history.
Okay, so this is the metformin, it's for diabetes.
It's always been part of the pharmacist's role to look at and find out what that patient was on prior to admission. We looked at that a bit further. Instead of just asking the patient, we take what we call a best possible medication history. We ask the patients and their families to bring in products so we can actually look at it, and then we even follow up with the patient's permission with their family doctor or with that pharmacy that they deal with in the community. This information now can be put into this electronic medication information management tool and then made available now to the clinician assessing the patient and making decisions as to what medications they need to be on.
The best medication profile does a few things for us. It really speeds up the whole process of getting medications ordered, and it also just makes it very clear to have one source to really know exactly those dosages and all the medications that the patient takes.
The system also provides alerts and recommendations to aid prescribing, based on clinical evidence, to ensure the best and safest patient care possible.
It's made a huge difference. It gives us sample dosages, so we know sort of the ranges of what medications should be ordered in. There's so much less errors in terms of what medications you ordered, the timing of the medications, the dosing of the medications.
Once a clinician enters the medication order, they are able to perform an electronic medication reconciliation to ensure that medications being added, changed, or discontinued are carefully evaluated. Any safety concerns will be alerted to the appropriate clinician for action.
You're documenting every step of the way, and documentation is so important in preventing adverse drug events, discrepancies with medications, and really you're displaying it in front of you, so it's that double check. This is a way for us to make note of the errors and be in direct contact with the team.
In fact, a recent review on the impact of hospital medication reconciliation supported by IT found significant improvement in medication discrepancies, potential adverse drug events, and inadverse drug events.
Technology also improves on the nursing care so that, the right medications are given to the right patients and that the dosages are correct.
Mrs. McLean, your morning medication. Okay. When it's done this way, when we get to the room, we'll see that there's a change in the medication. When we have it online, especially the best practice medication history, that helps us because when it's in the computer and it gets into the computer, we get the information faster.
The collaboration of all the teams, it reduces errors and makes their job so much easier and also makes it safer for the patients.
It's just one more reason that knowing is better than not knowing.